June today, Pennsylvania had 6,759 new positives, 144 new deaths. Cameron County increased by 3, Center by 93, Clearfield by 67, Clinton by 36, Elk by 27, Lycoming 47, Northumberland 59, Potter 18, Tioga 33, Union 78. Local zip codes, Renovo went up by 6, but they went up by 6 presumed positives and not 6 actual positives. We had 8 actual positives this week. So there may be another 8 on top of 26. Snowshoes went up 2, Mill Hall 3, Beach Creek went backwards by 9. Lock Haven up by 13, Jersey Shore 11, Bellefonte 14, State College 30, Loganton 1, and Williamsport 9. Lock Haven University is still showing 4 active positives for a positivity rate of 4.7. University Park did update their numbers as of the 23rd, 4,845 cumulative positives, 354 currently active, 8 in quarantine, 31 in isolation, waiting for results on 182 tests. Clinton County remains at 10% positivity rate. Center County remains at 6.7. Many of you may have already seen Keystone Central has extended remote learning through the end of next week. That was part of the discussion that we had this morning on the Emergency Coalition call. I also learned some other interesting information. As of today, in Pennsylvania, 3,990 people are hospitalized with COVID, 858 are in ICU, and 441 are on vents. Of those, 65 of those COVID positives are in Susquehanna Health System, UPMC Susquehanna. So that's Lock Haven, Williamsport, Muncie, Cole. When we look at the positivity rates in Pennsylvania, or in Clinton County as a whole, if you add up the last 14 days, that's 211 currently active cases. If you look at the last 30 days, there were 300 new cases. When you add up all the cases so far in November, it equals more than all of the cases we've had in the last 7 months. So November has been very, very active. LHU ended in-person classes for the calendar year, I believe. When we look at the projection models, it looks like January being the peak is actually what's going to occur. It looks like December is going to be a difficult month where we may see as many as 22,000 new cases per day. Clinton County is expecting to see similar types of increases throughout the month of December. So once again, the thing that I can stress is wear your mask, wash your hands every time you pass a sink, and if you don't need to be there, don't go.
Well, we have the hunting season upon us, and the thing that I've asked people to do during this period is, even though you're outside, you may be distanced, to use your mask up until you're going to have to use it to go after your animal. But washing hands is still an issue. I brought up this morning that a CEO of Sanford Medical Centers in South Dakota had decided not to wear a mask and sent out emails to that 50,000 of their employees. And he was let go this morning by the trustees of the hospital. They thought that that was reckless behavior. So I think that as simple as wearing a mask and trying to stay still, the airports are pretty full. That's showing us what we're going to be looking like in December. But other than that, the same thing, the basics. Wash your hands, masks, and social distancing where you can. Those who are in a bubble, they're recommending until you sit down to the table to wear a mask and during your communications in the house, and then sit down and enjoy your meal. But the employees here have done an incredible job at keeping everybody safe, and we're very thankful we have them in our building, and the administration has moved forward, and we've been pretty aggressive with trying to keep everybody safe. So we all thank you.
Questions? Yes.
Yes. Did you say today alone there was 443 deaths in Pennsylvania? Or was that for the month?
Deaths across Pennsylvania, 144 from noon yesterday to, actually these numbers are midnight numbers, so it would be from midnight tonight back 24 hours.
102.
144.
Okay, I wonder what the 443 number was. I had in my head.
I don't know. Other questions? All right, that's all I have. Thank you.
Thank you.